Alright, hi guys. So today I want to talk to you a little bit about training females and how it may be a little bit different from training guys. So what I want, there's loads of different things about training females, you know, like there's hormonal issues and all sorts of stuff. But yeah, I want to just talk super brief, Q angle. Okay, so what is the Q angle? Q angle is an angle which is formed by the way that your long thigh bone, your femur, hangs out of your hips, your pelvis. Okay, females have wider hips. They are more prone to knee injuries and what we might call patellofemoral pain syndrome, which is just pain in the knee, than men are. Okay. Do you know if you drink your coffee through a straw that you're less likely to get your teeth all stained? So that's why I'm doing that. But basically, everybody has a Q angle, and you can measure your Q angle. If you don't know any of the stuff I'm saying, you can just Google it. Right? Is that on the front of your hip, there's a bony protrusion. Right at the front of that, that is called your anterior iliac spine. So what you do is you find where your anterior iliac spine is, and you draw a line from that down to the middle of your kneecap. Then you find what's called the tibial tuberosity, which is the bony protrusion underneath your knee. You draw a line from that straight up. The angle which is formed by the line from the anterior iliac spine and the line from the tibial tuberosity, the difference between the two is your Q angle. It averages out at 18 degrees for females and 13 degrees for males. What that means for females is if there's an angle hanging down, they are much more likely to internally rotate their hip during squatting movements. Internal rotation of the hip is bad because your knee is a hinge. It does this. It doesn't like to do this. Okay? Also, it's more likely, apart from internal hip rotation, that you will collapse at the knee or do what we call valgus knee. This is also bad because the knee doesn't also want to do this. Okay? So you're going to damage what we call the articular surfaces of the knee. The cartilage is going to wear down. Females are more prone to osteoarthritis. What can we do as coaches to fix this problem or mitigate the problem? Is that you can strengthen the external hip rotators, which are going to be the glute muscles. I find that giving people work to do, females, I will likely to prescribe a lot more work with one of Mark Bell's creations, which is the hip circle. It's just a band which goes, it's elasticated and it goes around your thighs above the knee, and you will do movements like clamshells, or as I call them, good girl, bad girl, things like that, banded side steps, or even just putting one on and asking them to squat so they're having to hold their femur out into external rotation at the hip. Also strengthening the VMO, which is the vastus medialis oblique. It's the small teardrop of your quad muscles, which is on the inside just above the knee, that medial aspect. And that, you know, a lot of people say the VMO doesn't exist. It does. If it didn't exist, we wouldn't have a name for it, would we? So strengthening VMO by doing movements like step ups or eccentric step downs are going to be very, very good for that. And that's how to just make sure your female athletes are not, you know, getting themselves into a position with degeneration of the knee. And you know, I see a lot of coaches, they see what's happening, and I'll see them in class and they can see the valgus problem, the knee collapse, and they'll go, push your knees out, push your knees out. Now, as a coach, you got to remember that you have to coach, right? Seeing is not good enough. You have to fix. Otherwise, what the fuck are people paying money for, right? If it's like that, they can just pull up a YouTube video how to do a squat and then just go in a gym and do it themselves. You don't need somebody that's just done a weekend course, right, and is doing it part-time to make a bit of money to fund their, you know, surfer lifestyle or whatever, telling them to push their knees out repeatedly every single week with no change. So this is something important to understand. Q angle is more acute in females. You're going to see it during warm-ups. If you see it under, you know, without being under load, imagine what it's going to be like under load. I'm always looking for people during warm-up. If I'm warming people up for squats, guess what they're going to do as a warm-up? Squats. During the air squat, you're already going to see the beginning of those type of movement issues. Also during lunges and anything like that where they're having to take their knee through a range of flexion and extension. So Q angle, learn what it is, watch out for it, and appropriately prescribe things to help your athletes. All right, sayonara.